Welcome back to Weekend Prime, and let's now take a look at your favorite weekend segment. Now, the U.S. government's stop work order severely disrupted global HIV response, forcing governments to rethink how to bridge the gap left by the funding freeze on HIV programs. Kenya, for instance, embarked on integrating the crucial services into routine healthcare services, a move that has had its fair share of challenges that experts warn could fuel the surge of new HIV infections and high rates of treatment abandonment by people living with HIV, especially the youth. But how do we mitigate this? That's what Gloria Milimo explores on this week's episode of the Health Digest. Take a look.
Kenya is among countries that were caught up in a major financial deficit after the withdrawal of US government funding of crucial sectors in 2025. 1 year down the line, and the ripple effects of the stop work order continues to linger, shaping the HIV response in the country. The blow was swift and severe, throwing critical global health programs in chaos and leaving over 1 million vulnerable patients in the country staring at uncertainty. As countries scrambled to sustain vital health programs like HIV following the sudden freeze and termination of thousands of healthcare workers' contracts, for Kenya, transitioning HIV care from standalone clinics to fully integrated primary care was a strategy the government leveraged on to ensure sustainability of the critical services. Even so, while embedding services like HIV, TB, and non-communicable diseases seek to improve treatment access and reduce stigma among people living with HIV, experts warn that a new trend has emerged, one that is likely to erode gains made in curtailing new HIV infections that have held the country's youth in a chokehold.
So you find these young people, when they go to facility, and then that queue of a line from 8, and sometimes you're being seen at 4 in the evening. So they feel they're being misused. Again, when you go to pick your ARVs, disclosure, they're doing the disclosure direct without your consent. So you are given your bottles of drugs mbele ya watu instead of keeping you in a place where you can be able to be seen.
33-year-old Justin Rawinji, a resident of Nairobi who lives with HIV, knows this all too well. He says the changes that came with the transition continues to disadvantage the country's youth, who bear the biggest brunt of new HIV infections.
For the clients, it also came as a shock because, first of all, clients are very delicate people to deal with because they always come and they want to see those faces they are used to. So when they come and then you are told that there are changes that you won't be able to see this person or you won't be able to see the other person, that is also a shock to them. Institutions has to introduce whereby you go, you pay for consultation for you to get your to see a doctor for you to. That is one of the things that integration is going to do, or maybe is doing. They have to, it is like you have to pay for consultation to see a doctor. Whereas most people living with HIV in the past, we were used to coming, getting our ARVs, and then you go home. We are used to, because of the stigma, we are used to being there. We don't want to spend a lot of time in our clinics.
At least 52 people are diagnosed with HIV every single day in Kenya, translating to about 19,991 infections recorded annually. Infections that experts warn could derail efforts to end HIV as a public threat by 2030. Nelson Otuoma, who heads an organization that aims to improve the quality of life of people infected and affected by HIV, laments that the mass layoffs left a gap that continues to threaten the well-being of people living with HIV in Kenya.
Now, going forward, the doctors are also very few. And this is the same doctor or nurse who is also taking care of children, pregnant and breastfeeding mothers. And therefore, they do not have adequate time to take with the person living with HIV.
And while they essentially depend on these facilities for the much-needed services in order to keep their health in check, the absence of the crucial cadre of healthcare workers demand that they now begin to take charge of their well-being. Otuoma says, leveraging self-care strategy, which empowers people living with the condition to take an active role in their health, will help shape HIV response in the country.
Self-care is the ability of an individual with an infection or a lifelong condition to do what is required to stay healthy with or without the doctor.
Part of it entails treatment literacy that encompasses knowing the kind of ARVs one is on.
The treatment literacy requires that you know it by name. It is first line, and it is called dolutegravir, or it is called nevirapine. Because when there was a stop work order, we realized that there were people who, actually even healthcare workers, some of them didn't know the medicine people were taking. And they ask you, I want to give you medicine, I have it. Which medicine can I give you?
The self-care strategy also emphasizes on strict adherence to medication in order to keep the virus suppressed and avert resistance, among other benefits. It also recommends support groups for people living with HIV and capitalizing on their ability to offer safe space to navigate treatment, adherence, and even combat stigma.
We have started organizing community ART groups. And community ART groups is where you have 20 to 30 people who live with HIV, and they form a group, and that group, a leader, can be going to a facility to collect medicine for the rest, for the peers. Now, the advantage with that is that then, whereas each one would have been using 200 shillings for transport, now you only get 200, which you contribute to the leader comes back, and because each one knows their medicine, once the doctor prescribes, the leader brings back to the team members. Again, this is a way of making sure that we decongest health facilities.
Currently, stakeholder engagements are underway to develop self-care guide that will be launched in July 2026 in all the 47 counties. Gloria Milimu, KTN.